The topic for today on medical rheumatology is ankylosing spondylitis. So let's get on with it. Now, the word ankylosing spondylitis is composed of two very different processes. Now, ankylosing means fusion of two bones. Now, these bones can be membranous bones, they can be cartilaginous bones. So, if there is fusion of two bones via ossification, it's called ankylosis. And spondylitis is the process by which there is inflammation of the vertebra, or more specifically, the vertebral body. In opposed to that, the inflammation of the spinal cord is called myelitis. So if we want to differentiate, inflammation of the spinal cord is myelitis, while inflammation of the vertebral column is called spondylitis. And when that inflammation starts to result in the fusion of the vertebral column, that the vertebra start to fuse together, this process or disease is called ankylosing spondylitis. So in order to summarize that, we can say that it is an inflammatory disorder, as denoted by the word itis, that it is an inflammatory disorder of an unknown cause. We do not know its exact cause. We do know what is the incitatory event, what is the precipitating factors, but we do not know what is the exact cause which causes such inflammation that primarily affects the axial skeleton. Now, axial skeleton usually composed of the vertebral column and skull. Skull and the vertebral column form the axial skeleton, while the rest of the bones, that is the rib cage and the bones of the limbs, they form the peripheral skeleton. So, ankylosing spondylitis, as denoted by its name, primarily affects the axial skeleton. So, the term axial spondylitis is also coming into the view, even though it's not used much, but the word an axial spondylitis and ankylosing spondylitis can be used interchangeably. Now, another thing is that this being an inflammatory condition, it does not only affect the axial skeleton, it can only have some peripheral inflammatory points too. Usually the peripheral joints, they are affected, and the extraarticular structures which are usually found around those joints. So this would be the medical definition of ankylosing spondylitis. Now let's talk about the epidemiology. Now, epidemiology of ankylosing spondylitis is that it starts during the second or the third decade of the body of human beings, or in order to get a mean age, usually it starts around the age of 23 years old. So it's not a disease of children, it is not a disease of young adults. It usually starts during the second and the third decade. But do note that there is a subtype of ankylosing spondylitis called the juvenile ankylosing spondylitis, which can start during both the pediatric age and the teenagers. Next, we have its prevalence. Now, prevalence in any population regarding to the condition that we're studying is important because it affects our decision to diagnose a certain condition. Now, we know that it has a male to female ratio of 2 to 1, that men are more affected by this disorder than the female. Now, why it is so, why men are more affected and women are less affected, we will discuss this later on. But do note that it is a disease which affects the male gender the most. Now, continuing the epidemiology, we're going to talk about the genetics. Now, genetics play a huge part in not only the distribution, the prevalence of any given disease, but they also have some significance in its pathology, pathogenesis, diagnosis, treatment. So, the study of genetics in any disorder is compulsory. As for the ankylosing spondylitis, the HLA-B27 or human leukocyte antigen designation B27 is of extreme importance. It is this protein, the HLA-B27, and the corresponding gene that translates into this protein is of much importance. Now, let's take an example of white males in Northern America. 7% of all white North American males have HLA-B27. 7% of all of those. And every person who is affected by ankylosing spondylitis, 90% of those have HLA-B27 in their body. So as you can see, HLA, the expression of the leukocyte antigen, is highly significant to the both pathology and the epidemiology of ankylosing spondylitis. Next, we're going to talk about the SNP or the genome-wide single nucleotide polymorphism. Now, why this polymorphism is important regarding the genetics of ankylosing spondylitis? It is so because we know that polymorphism means that there are one way or another multiple copies of the same genes. Either the gene repeats itself or there are multiple alleles of that said gene. Now, HLA-B27, through this genome-wide SNP studies, we know that it has more than 30 alleles. So that is the reason why the HLA-B27 is expressed so frequently in the white male population, and also why it is so heavily associated with the ankylosing spondylitis, because the 90% of every patient of ankylosing spondylitis will have an HLA B27. Now, it is important to such a degree that there is a concordance of about 65% even in the identical twins. Now, we do know that when there is some problem with HLA B27, somehow it will result in ankylosing spondylitis, and mutations are usually random. But since we do not know the exact incitatory event that actually causes the HLA-B27 to malfunction in that manner, we do know that it has to do something with the genetics, because in identical twins which have the same identical makeup will have 65% chance. If one twin develops ankylosing spondylitis, the other one has about 65% chance, or 65 in the 100% chance that it will have ankylosing spondylitis. So that's how much the genetics of both HLA is important in both understanding the disease, diagnosing the disease, and treating the disease. Okay, now let's talk about the ankylosing spondylitis. Now, whenever we talk about any disorder, or any condition, we have to talk about its signs and symptoms. Now, we know that it affects the eyes. About 40% of all patients with this disorder will present with anterior uveitis. We know that even jaws are affected in about 15% of the population. Neck is most commonly affected in about 75% of the population, but that is more of a general effect that any part of the neck can be affected. Next, shoulders, even though they are rare, but still about 30% of all patients, ribs, 20%, ribs or the spinal junction or the costocervical junction or the rib cage as a whole has about 20% prevalence in patient with ankylosing spondylitis. Likewise, the lumbosacral area, 50% of the patient. As for the sacroiliac area, 100% of the patients. Now, that means that every person who is affected by ankylosing spondylitis will present with some kind of problem with the sacroiliac section of the body. Then we have the hips. Now it is about 30% of the population. Wrist is very rare in about 20% of the population, and even if it is affected, usually it is asymptomatic. Then we have the fingers. It's about the dactylitis is only about 5% of the population. Then we have the knee, only 20% of the population. Heel, only 30% of the population. So as you can see here, only the sacroiliac area has the 100% prevalence. So any inflammation of sacroiliac area called sacroiliitis is the hallmark of ankylosing spondylitis. Every patient with this disorder will present with sacroiliitis. The other most important presentation is the anterior uveitis of the eyes. 40% of all patients will present with anterior uveitis, and it is important because sometimes anterior uveitis is antecedent to the ankylosing spondylitis, meaning that sometimes it presents before even the symptoms of the ankylosing spondylitis develops. So that's why the inflammation of the eye or the anterior uveitis is more important, because sometimes it comes even before the disease in which it is a part of.